Welcome to my interview presentation. My name is Mason Young. This is a project for Counseling 5350, Foundations of Counseling, through the Department of Counseling at Tarleton State University, and my professor is Dr. Chris Wilder. I did my interview with my current therapist, Silas West. He graduated in 2014 from Grace University in Nebraska. Grace University no longer exists, however, he is credentialed through the University of Nebraska. He specializes in PTSD and trauma. He is dual state licensed in both Nebraska and Texas. He started as a pastor and in ministry work. He was the lead pastor, and then he wanted to get into counseling, so he transitioned into counseling. Once he was licensed, he started working as a counselor full-time, and now he owns and operates his own independent practice. Mr. West and I covered a plethora of topics in our conversation. However, I split this up into two categories for us, so this could be easily digestible in a presentation. In this first side, we are going to focus on independent practice, looking at insurance, knowing what you can handle and what you need to delegate. Second, starting your internship and your niche, or as close to your niche as possible, understanding what your focus is and what you want it to be. And then 3, evolving your methods and practice from all your previous experience. Something we've talked about at length in class is insurance, and that is no doubt something that came up in our conversation. So we talked about knowing what you can handle and what you need to delegate. As an independent practice, Mr. West works directly with insurance companies, and so that takes up a lot of time doing his documentation for billing. What he did is he found a third-party company that works with about 60% of his clients and the insurance companies that they have. And all he has to do is submit his diagnosis, his hourly rate, and that he met with them, send it to that third party who charges him a flat monthly fee, and they put all of his clients together, get all the information, charge the insurance companies, and then provide him with a weekly check from the insurance companies on what they cover. I was blown away whenever he was explaining this process to me. Obviously, 40% of his clients, he still has to deal with the insurance companies directly, but for the other 60, it was brand new information to me that there was a third-party company out there that for a flat fee will help you with your documentation and billing, because insurance is such a hassle in the independent practice field. The second thing that we talked about within the independent practice realm was starting your internship in your niche or as close to your niche as possible. Mr. West provided his personal story of wanting to integrate his minister studies as well as his counseling studies and provide counseling in ministry, specifically overseas, with people who were doing the Lord's work in other countries. He talked about how that did not exist at the time in Nebraska, and he had to find a supervisor that provided full support and a shared vision. He talked about working under that supervisor. He got a lot of generalized experience, and that was really helpful for him as he was able to build his foundation in order to work better within his niche. This is something that I take a lot of draw from, as my interests are very specific, and it is something that doesn't quite exist in totality here in Texas. I know other states have it in a more full aspect, and I'll definitely need to find the right supervisor, as we all will, but specifically one that I can get a lot of generalized experience to work in my niche in my field. I was very grateful that we dove into this topic because it is super applicable to me in the future. The final topic that we talked about within the independent practice realm is evolving your methods and practices with all your previous experiences. He talked about using recovery plans from previous companies that he worked for or his supervision and internships, as well as adapting to generational change and generational communication, and then the overlap of clientele. Maybe his clientele have a different diagnosis, but you can work with them similarly. I found this to be extremely important as it directly correlates to where I'm at right now. I'm at the beginning of my education in this field, which means that my counselor identity has not fully been molded, and the core of what I want to provide as a counselor is not fully molded. So everything that I'm taking in throughout this process can help me evolve and be a better licensed counselor in the end. The second category or genre that we got into was client interaction and ethical dilemmas. He talked about the hard aspects of counseling, giving me tips and tricks on what that may be and what to look out for. Discharge and appropriate handling of end of care, something he said is often overlooked but very important. And then third, the geographical possibilities. This includes military and overseas care. This was something I had not thought of before, and is something I'm interested to dive into more. The first and probably the largest thing that we talked about within the client interaction and ethical realm was managing your personal bias. Mr. West talked about for himself, he has a bias of clients that he can see tangible results or they communicate with him their tangible results. He likes to feel that he can see a difference through his work, and he said that he notices this bias and this is something that he has to manage. He also talked about how the clients can have a bias. Sometimes clients come in and they expect you to be the expert. They want you to tell them what to do in life. He said for himself, this makes him feel inadequate or like a fraud because although he is licensed, you will never feel that you can provide somebody with the answers to their life or give them the answers to change their life. You can help them and guide them, which is something that we talk about at length during this course and this class, and is something that was very reassuring to hear him talk about. It felt very real to have a professional kind of break down that barrier and explain that some days you don't feel like you're enough, but you are. Taking out the emotion from the fact and understanding that you are doing your job and you are doing the job to the best of your ability. And although you may feel that you are not providing something, you are. And to keep going forward at the pace you're going, that was just invaluable information to me, and it is something I'll keep in my back pocket going forward. Something that is often not talked about or overlooked is the discharge and appropriate handling of end of care. This is something that Mr. West and I talked at length, and he really opened my eyes to something I had never thought about. He talked about experiencing clients that are tough to get a hold of, or maybe they want to quietly end their service with you. He talked about maintaining a consistent professional communication, as well as documenting the time elapsing between appointments. Having an open line of communication and being pretty steadfast with your communication is very important. A lot of time, clients will just not book or won't tell you that they're not going to book for a long time. So sending email reminders or checking in, especially if your client is high risk, making sure that you are doing your due diligence and maintaining that professional boundary of communication, but also making sure that you do handle the end of care and the discharge appropriately when it needs to happen. This is something that he struggled with at first, and as he was explaining this process, I knew it was something that I was going to struggle with. Setting those hard boundaries can be very difficult, especially as you start seeing a client more and you have a professional relationship going on a week-to-week or bi-weekly basis. Quite possibly the most interesting topic that we discussed was our final topic, which was geographical possibilities of our service. Mr. West kind of quickly slipped in that he sees clients overseas, and that of course perked my interest because I know the LPC license is state to state. He talked about knowing what your state can and cannot do. That is very important. For himself, he knew that Texas was very loose, or at least a looser ruling state than others. So for him, a lot of services he provides are for people overseas. If you have a business that you work for within the United States, but you are not on U.S. soil, a Texas LPC can cover them, specifically if they are military or maybe missionaries. That is something that he talked about he covers. I thought this was very interesting as we have Fort Hood and Lackland Air Force Base. We could have LPCs licensed to provide military service and counseling for our military members. This really got the ball rolling for me in my head and kind of blew open everything that I'd previously thought as far as geographically being set to where you are licensed, and something to look forward to and kind of dive into deeper with other states and understanding how that may work. The biggest thing to keep in mind, as soon as a client does come back to the U.S. and they are back on U.S. soil in another state, they cannot be seen by you. They must be seen in your state per your state's rules. Lastly, I wanted to say thank you to Mr. West. Our conversation opened up my eyes to new topics, and it was greatly appreciated.